Hello there, I'm Nick.
And I'm Helena, and we both work at the MS Trust, a charity for people affected by MS in the UK. We are here to help you make sense of MS.
Thanks so much for listening today to our podcast, Breaking It Down, where we talk all things MS, how MS affects people, how MS might impact your day-to-day life, how to live with symptoms, and how to live the best that you can do with MS. And today we're going to be talking a little bit about how to make the most out of your appointment with your neurologist.
Yes, appointment with your MS team or your neurologist, as we're talking about today, gives you an opportunity to ask questions, discuss treatment options to help you manage your MS. And the time that's available is usually quite limited. So this information provides some suggestions on how to make you sort of the most of your appointments and get the best out of your MS team, which will also sort of include an MS nurse, which we will be coming to in a future podcast as well.
Not to sugarcoat things at all, Helena, because we know how difficult it is in terms of the challenges that the NHS faces at the moment in time. You know, we hear from people who live with MS that they're really struggling to get an appointment. They can't see their neurologist at the moment. They're on a huge waiting list of, months or even up to a year. So we know that, if you're not diagnosed with MS at this stage, or you think that you might have MS and you're waiting to get that first appointment, we know that you're not the only one in that position.
Yeah, so we decided that we wanted to do this episode because we get a lot of questions about preparing to see a neurologist, what kind of questions you should ask them and how to best spend that very limited time that you get with them.
Yeah, and it's almost like something to help you emotionally as well for that time. Your head's like to be swimming with lots of different questions, so many sort of unknown factors that you'd want to discuss. So it's to give you a bit more of strategy and structure, so that actually when you do get to that appointment, instead of feeling overwhelmed with all of that information, actually it can give you a bit more of a structured way to approach it. And we did also want to hear from a neurologist from that side as well, so that people can find out what the best thing to do is when they're waiting for their appointment as well, because we know that can be a really difficult time too.
Yeah, and waiting can be so hard, and especially if you're not yet diagnosed or you feel like something's wrong, there might be a new symptom that has occurred, or you might be waiting to find out some results for some test. I know I had an MRI scan last November last year, and I had to wait several months before I got the results of that scan. So I don't know, I'm very impatient, but I'm an impatient patient. So I really struggle to get on with life when you have some medical appointments to wait for. It can be really tricky to sort of, not just constantly think about what is going on, what's happening, what am I waiting for?
Yeah, absolutely. So many people are in that position, aren't they, Helena? So we thought a great person to talk to about this one would be one of our MS Trust ambassadors and friend of the podcast. So we reached out to Dr Agne Straukiene, who's a neurologist in the south of Devon. So we went over, lots of different aspects of the preparation, what to do in the meeting, what notes to take with you, maybe who you can take with you as well. So without any further ado, let's jump into the interview.
Yeah, let's have a listen now.
I'm joined by Dr Agne Straukiene. How's it going today, Agne?
Yeah, very good. Today is the first day after heavy raining. It's sunshine in Torquay, so I'm so excited. Gonna go and do some outdoors, maybe do some tennis, play some tennis. Get that sunshine getting into my skin and body and prevent me from all these viruses around. That is like peak time for COVID and flu type symptoms that are overwhelming our health systems, as I noticed. So I want to do something good to my body to prevent from developing any flu type fever symptom in autumn living in Britain.
That sounds good to me. I can imagine you're tennis whiz, so you'll be much better than I would be. If I can
I
get it over the net, I'm quite happy. So yeah, we'll go from there. For anyone who's not familiar with yourself, I know you've done lots of work with us before and lots of work with other MS organisations as well. But would you be able to introduce yourself?
Yeah, I'm a neurologist. I'm committed to a career in neurology with a special interest in multiple sclerosis. I became a consultant in 2016. I'm a MES service lead at Torbay and South Devon NHS Foundation Trust. I'm also a senior lecturer at University of Plymouth. I am very much into healthy living and healthy lifestyle for people living with MS or any other autoimmune condition, as I noticed there is a very huge interest and lack of understanding and knowledge and education in this area. I'm also very innovative and developing various different tools that helping to improve MS services and also improve patients' outcomes. I'm also a researcher. I'm doing a lot of research, running various different clinical trials as a PI, principal investigator, and also I am a CI of chief investigator of a few clinical trials focus on patients' outcomes, improvement, quality of life, communication, connection, using digital technology to assess people's motor function at patients' homes, such as using augmented reality. I have pioneered setting healthy lifestyle MS clinics at Torbay Hospital. And as a team, we were awarded by Brain Health Award in 2022, which we are very proud of. I'm also a founder and a host of Be Well with MS podcast. So I'm very pleased to be here today, Nick, and talking about such an important topic, how to get prepared for the clinical consultations for people with MS.
Amazing. Wow, there's so much that you do, isn't there? And it's amazing just hearing all the different strands to your bow there. So, yeah, amazing. Thank you so much for joining us. So, today we're going to talk about how to get the best out of your neurologist appointments. And we know we're not going to dive too much into the situation that we see the NHS in at the moment. We know that there are lots of people struggling to get to see their neurologist or waiting for extended periods of time. So we're not going to dive into that aspect of waiting for appointments and etc. But when you do get to see your neurologist, what would you say, Agne, are sort of the best things that you can do so you can get the very best out of that appointment?
To make the most of your appointment with a neurologist, it's essential to be well prepared. And here are some tips I would like to share with you. It's very important from neurology perspective or neurologist or nurse perspective, sitting in a clinic and waiting to see you is if you could compile a medical history of yours. Write down things that had happened in your life and obviously the health related any medical history is super important, previous diagnosis, symptoms, medication and treatments, and if you could timeline these events, maybe in 2004 this happened, in 2006 this what had happened. We quite often go down the timeline, but it's important to save the clinical consultation time if you're prepared. You know exactly, you don't need to sort of go back and sort of take your time to think. You just spot on, you get throughout the dates and events in your life, and it's so easy then for the consultant to understand the nature, the trajectory of the condition that you're living with. It's only going to enhance our making decision processes towards your diagnostics and further management. Also, keep a symptom diary. It's important to document what symptoms, how frequently, what triggers these symptoms, what's the pattern, what alleviates those symptoms. Just provide that valuable information to your neurologist. Also, get your questions listed. Write down a list of questions or concerns you have about your condition. This could ensure that you don't forget anything during the appointment, because the appointment is almost like standing on the stage. You are under a lot of stress at the same time, because it's not nice. Nobody likes to come to the hospital. Nobody wants to talk to the doctors and nurses. It's almost like it can affect your memory. You become a bit muddled, a bit foggy in your mind, because you just stress that, affects your memory of the events in the past. So, and what's going on day to day, it's super important. And maybe bringing a person with you, like, a family member, a friend, anybody that could accompany your appointment, and take notes, and also offer you emotional support. There's nothing more beautiful than seeing patients coming with their good mates and friends and soulmates, and spouses and wives and husbands. And sometimes the emotions can be on board, and we sort of sometimes, by accident or without intentions, we bring out these emotions. The tears comes, the sadness comes, because you're sort of almost going through your timeline, and you're remembering things that brings a lot of feelings, and emotions at the same time. So nothing is more beautiful when the spouse or your friend is holding your hand whilst you're going through that tough topic. So I think that's important. Then the person that is next to you could take some notes as well, that you could then remunerate and sort of delve again into the subject that you discuss with the neurologist, and be always open and honest. We're not embarrassed to listen about your gut function or bladder function or sexual problems that you've got. I have to say, we're so numb to the feelings and emotions that may be attached to somebody else, that has nothing to do with the looking after other people and health. We are looking at you as a biological unit, and we're trying to see how all these functions and organs works together. Is there a disconnect between the brain and the bladder, between the bowel and the bladder, between the heart and brain, between the stomach and the brain? So if you hide, if you're not open, you're never going to get a decent help or a plan that will improve your symptoms, improve your quality of life. And had some patients coming and say, "Oh, I haven't mentioned that because it's so embarrassing." No, forget about this. We are here to support. We are in the room of, the door is closed, the windows are closed. Nobody's going to listen. And when we finish our clinics, we forget about the things that we discussed, to be honest, because we all have our own lives. We just go and live our lives without, thinking, what did you say? So be open, transparent, honest, and that's the way to get some help. And it's important to discuss the treatment options. And, if it is a symptom management, if it is a relapse management, if it is a disease modifying therapy management, having that discussion in the clinic, it's super important. And make that in your notebook, that's the area and subject that you need to tackle with a neurologist or MS specialist nurse.
Wow, so much information there. So it's amazing. So, from sort of making sure you bring someone with you, maybe to take notes and for emotional support, and really having that preparation prior to going. So you've got your medical history, your questions, the journey, the timeline. And I was just thinking, Agne, when you were sort of talking about the preparation, does that help you from a neurologist side to sort of for you to make sure that you're giving the best to your your people who are coming to see you?
Yeah, absolutely. As neurologists, it really is important to have this structured, segmented plan in your clinics, because there are so many aspects that we need to cover in 15, maybe 30 minutes, depends which service are you representing as neurologists. And talking about life and getting involved into emotional impact on your healthy living, it's not the way that would lead us to making decent, clever, smart, adequate, life improving, life changing, game changing management plan. It's important to stick to the structure. We actually are developing some sort of package for newcomers to our service and for people with established diagnosis. What is the expectation from us healthcare providers to the patient? What do they need to do for us? There are other unique challenges for individual service, and you may also collaborate with your own team and find out what is the expectation from you as a patient for this particular service. Because some services are doing some questionnaires prior to the clinic. Some people are asked to do certain assessment assessment, like 9-hole peg test, like timed 7-meter walking test before they, reach the clinic. So you have to work at the individual basis and talk to your healthcare providers and see what do they want, because it's all gonna in as an end product is you being well with the management that we set in place. And we can only do that if we have a structure during the clinical consultation. That's super important. There are so many apps available where you could track your symptoms, record them, write the questions, get ready. There is a yourmsquestionnaire.com that one of the pharmaceutical companies developed a questionnaire to get you ready for the consultation. Again, that lists the symptoms, evaluates the symptoms, and gives you the sort of a feedback after you've done the questionnaire. So many tools around. You need to talk to healthcare provider and find out more, because it only enhances our clinicians' performance at our work, because you're going to help us. So we're heading into sort of self-management, collaboration, working together in a partnership. And how can we achieve this beautiful connection, you as a patient and me as a healthcare provider?
Wow, that's really interesting hearing about some of the sort of different tools that are available, because, if you're kind of new to seeing a neurologist and you think, oh, you have that feeling of, oh my goodness, I don't know what to ask, I don't even know where to start. I'm, potentially feeling a little bit worried and anxious, or maybe embarrassed to talk about some of those functions, like you were saying, Agne, like the, bladder and bowel, or sexual function. So actually, it's really cool to hear that there's places that you can go to that sort of almost give you that structure of things that you can talk about, things that you might want to consider asking about.
Yes,
Yeah.
absolutely.
If someone was coming to you for the first time, or coming to see any neurologist for the first time, is there anything that they could expect?
So the clinical consultation for new diagnosed patients, newbies coming to MS service, just expect a thorough medical history review. So any homework that you're going to do before coming is going to bring a lot of value into the clinic, because you're going to go down this timeline, and neurologists will be assessing and asking questions about your history, medical history. Then expect a physical neurological examination, which involves looking at your face, expression, how you move your face, whether you have asymmetry, droopy eyelids, droopy nasal label fold, whether arms are you able to lift your arms up and down, what the strength you've got, what the balance coordination. Neurologist is unique, that holds the tender hammer, that taps your reflexes, checks other pathological reflexes by scratching your foot, your sole, and doing various different maneuvers, which may feel a bit odd, but it's like a little dance or game that you're getting involved under the instructions by neurologists that are going to conduct this neurological assessment. You will have a chance to discuss your symptoms, your concerns, also possible requests for diagnostics, which involves maybe repeating MRI scan, maybe adding MRI spinal cord if you just had a MRI brain head only, lumbar puncture, looking at the biological markers. These days we look at the oligoclonal bands, neurofilaments, IgG index, kappa light chain biological marker. Evoke potentials, which is a conduction study looking at how the signaling is coming, how speedy the signaling is coming to your eyes, optic nerves, our upper limbs and lower limbs, and some sort of we call this MS mimic blood test, that we look at the other potential alternative diagnosis that could potentially mimic multiple sclerosis, and that involves an MO spectrum disorder, MOG-associated disease, vasculitis, syphilis, HIV. We look at the vitamin deficiencies. We look at the EBV virus status, whether you have active infection or previous infection, CMV virus, various different things that we check as a panel at the very beginning, at the start, as part of the initial diagnostics for multiple sclerosis. And also, there will be some initial discussions around how can we best modify your disease, your immune system, how can we prevent you from not having multiple relapses and new formed lesions, and how can we slow down the progression of this disease. And also the current practice, which has changed in the last decade or so, we address the lifestyle, we do recommend some lifestyle issues or approach to living much healthier to preserve the brain health. And everything is just the aim to understand your condition, your uh, the way you're going to work with a consultant, how you're going to together make informed decisions towards your treatment plans. How can we tailor the advice to your unique life and your personality, your identity, your lifestyle? It's super important that we have this collaborate connection, and we sort of understand who you are, what do you do in your life, what's your adherence is going to be to our management plan. Are you prepared to have all these investigations and treatments? Um, so so we try to be empathetic, and we try to be passionate what we do. We try to listen. We try to do our best job we can as a neurologist. But you have to take into account that we are human beings. Sometimes we have huge issues within this service. We have huge issues with being understaffed. We have huge issues at home. Maybe there are people who are ill at home, and sometimes our attention could be occupied. So we have to sort of admit that we all are human beings, and we have good days and bad days. Even if your experience was maybe not the best one at the very beginning, give a bit of time to the neurologist. Maybe arrange another meeting and have another discussion. You will find that common language over the time. Just be patient, be kind, and we will be kind to you too.
Wow, it's really interesting to think about that side of things as well, and to try and build that relationship with the neurologist and the person who lives with MS as well early on, and then hopefully, you'll move forwards in the best way possible for that person. So yeah, that's amazing, Agne. And if someone's listening to this and they think, right, okay, I've got a neurologist appointment coming up, whether they're newly diagnosed or whether they're a little bit further along in their MS journey, um, and they think, okay, right, prepare, getting my prep done, writing a list of questions. Are there anything that, maybe someone might write down that actually wouldn't be appropriate for a neurologist to answer? Do you get any kind of common questions that come up that you think, actually, I'm not best placed to kind of talk about this in clinic?
Hmm. Well, neurologists are experts in the central nervous system and conditions like multiple sclerosis, and also other central nervous system autoimmune conditions that affects and cause white matter lesions. But there are certain questions that neurologists can't answer for definitive. For example, they can't predict the exact course or trajectory of your condition and provide the guarantee about the effectiveness of the specific treatments. Sometimes it could be a trial and error of managing your symptoms, and we have to go down there maybe 5 different medicine before we establish one that actually works for your symptoms. So it's difficult to know what side effects you're going to develop. Also, we can predict to a certain degree if, for example, we have patient coming with predominantly spinal cord lesions, young age, male gender, and presented with a very severe relapse at the very beginning, and has got biological markers quite nicely raised, which would indicate that somebody's having a very active demyelinating process. We could guarantee that this person probably in the long run is going to have even more episodes, more severe episodes, and there's going to be a cumulative effect on the brain health in the format of the plaques and lesions. you know we can't specifically define for some milder cases what's the nature is going to be. Sometimes people present with the mild symptoms, but then they have severe episodes, and then there is an element of the aging process, immunosenescence of the immune system. So again, it's emerging research area that we're trying to understand how the aging process affects, or whether disease modifying therapies are still effective in the older population. and also what the implications are of the lifestyling and adequate lifestyle tools that we would recommend for people, whether it's going to modify sufficiently, or it needs to be a combination of the factors that, lifestyle, high potency disease modifying therapies, proper symptom management. Every journey is unique, and we wish we had the crystal balls that we could look and prognose your future. I think a lot of an anxiety from the patients comes from, lack of predictability, but you don't need to live life with MS and expect that something horrible is going to happen to you, because it's not a clever way of living this life. We're addressing the anxiety that may happen living with this condition, but knowing how to manage that in an inadequate way, whether it's coming like from mindfulness, being mindful, not dwelling too much on the future, because it's impossible. I don't know what's going to happen to me, like maybe I'll be hit by the car, so you can't live life and sort of wait for something horrible to happen. Bear in mind that 95% that you have these horrific stories in your mind, they're never going to happen anyway. So it's our mind that sometimes produce these worries unnecessary. And just, if that happens to you, just say thank you to your brain. So say thank you for reminding of the events that may potentially occur in my life, but may not. And just move on, focus on what's in front of you. What do you do? What's around you? What the sounds you hear, what smells and everything. Just bring that attention to the present moment without worrying too much. And neurologists, you know should be doing the same thing, to be honest, because it may feel like when you come to the clinic that it's your problem, it's your disease, it's you, it's everything is. No. When the patient hit my clinic, and I always transparently and openly say to my patient, look, this become my problem too, because I need to understand you, I need to understand your biology, the nature of the condition, the prognostication, if possible, using all these biomarkers and MRI scans, and including gender, age, and everything else that I could so far. It becomes my problem. So we share that problem. So you don't need to feel like this is just your problem. I'm coming here to help you, and shared worries are a bit lighter than just having that on your own shoulders.
Yeah, I love that. It's sort of turning it round so that actually it's a problem that you can face together, and someone else on your side, isn't it, who can go on that journey with you. That's really nice to hear. We've sort of, we touched upon waiting lists are very long at the moment within the NHS. Where might people be able to go to with, if they've got burning questions and actually they've got a long way to wait until the next neurologist appointment? Is there anywhere that you'd recommend sort of going to just kind of alleviate some of those worries, to get some answers?
Yeah. I suggest that you reach out to your primary care physician or general practitioner with questions and concerns. I know. I can hear your voices now, listeners. I'm with you. I know how difficult and challenging it is to contact your primary care physician. You may not have an immediate answer, like, but you can book an appointment in 2 weeks' time to see your GP doctor. It's still possible. Although I know how primary care feels, they do feel overwhelmed. They have so many patients to deal with. And if you live with a chronic condition, sort of you can wait in a way. That's how the primary care physicians look at you, because there are some oncology patients and MI patients coming through the door, and they might need immediate answers and help. But, living with MS, you have a bit of time, 2 weeks, 3 weeks, 4 weeks, you can wait. But again, you could prepare in a similar manner with your GP. Bear in mind that they have even shorter period of time to listen to you. So you need to be very clever and make sure that you have at least one question that is most, or two questions that are most important, that you could ask your primary care physician. Join online support groups and forums. Depends on your locality. Sometimes the healthcare systems well, not sometimes, always they are different. Depends where you are, which country are you representing. If we look at the USA and NHS, complete two different. So we're comparing Apple versus Orange. Different system, different approach, different structure, and different time line as well. But make sure that if you are linking and linking to the support groups online, make sure that they are within the same country. If it is UK, so you try to reach people who lives in UK, and they are under the same NHS system. If you're in the USA, reach out to people and support groups that live in the USA and they are exposed, and they face the same system. So shared experience and advice is super important. Sometimes little questions, some few questions that you could get immediate response if you go online. Also, contact your MS organizations, whether it's MS Trust, MS Society, MS Together, so many other organizations that are around. Make sure that they maybe are local. There are some foundations for um, relevant information and resources that you could get immediately in the format of the leaflets, booklets, online resources. Also, maybe if it's too long, you can't get through, you've been waiting for a year or two, maybe consider seeking a second opinion, in particular if you're very, very concerned about your health. Don't go quiet and assume that you will be heard. It doesn't happen these days. You really want to make that sound and noise. It's sometimes it feels like being in the war, like if you're quiet, not necessarily you get that attention immediately, and the priority goes into somebody who shouts a lot. But be kind at the same time. Don't overwhelm us as the clinicians if possible, because I'm coming with an open heart to you. I'm here to help you. But if you start making a lot of noise, and every single thing that you're not certain, and you can't get some answers from your forum online supporters, primary care, that's the time to come to me as a specialist. But just divide that information and seeking information approach into numerous amount of the support and resource that you can access. But yeah, so let's be kind to each other, basically, if we want to get immediate attention or medical input. And if it is that bad, if you're really struggling, and if you can't lift your legs, and something is dramatic, stroke-like type presentation, we have emergency services. We have acute medical units that is in between the hospital and the ED. So out of hours Devon doctors, that are here to support everyone, depending on what's going on. But be mindful, be reasonable. If you're not sure, ask other people, how they're doing, what would be their advice, how could you best approach the clinicians. Let's work together. The current environment is challenging for both clinicians and patients. We are coming as insiders of the health systems, that we are feeling burned and overwhelmed, and everything is just too much, you see. So yeah, so finding that sort of right balance. But if you're in crisis, if you're not passing urine, if you're not moving legs, if you can't get access the shower because you are not able to mobilize, these are crises. These are immediate attention requiring approaches. So you could always contact your I'm sure you have contacts of your MS nurses. Even if they are not responding within 72 hours, they will do in 5 days time, I'm sure. But crisis like that requires acute medicine input, because usually the services, the way we run them, they are not acute services to provide catheterization if the bladder is not functioning, for example, or do some immediate scanning. It takes a bit of time. With the way we set up is for more sort of chronic input rather than acute medicine input. So be mindful. If you're not sure, talk to people, talk to friends. Sometimes you have that blind spot that you don't see yourself what's going on with you. So get some sort of other people input into your care, and their advice what you should do best to improve your quality of life and symptoms.
Yeah, I think that's so important, isn't it, to talk to other people and to get, another opinion. I think that was a very realistic
Mm.
approach to the situation that we're in now. I know it, you know, we we can't wave a magic wand at this stage, and we wish that things were different. But there
Yeah,
is support out there, so that's really good to see.
yeah.
For people, we know that your podcast is all about living as well as possible when you live with MS. But while people are kind of waiting for their next neurologist appointment, is there anything that you'd recommend in terms of health? How can someone stay as healthy as possible in between their next appointment with the neurologist?
Yeah, so I'm pretty sure people who's got metabolic problems, obesity, overweight, diabetes, high blood pressure, they already had some recommendations from physicians, primary care physicians. So follow those recommendations that already you received as part of living with other comorbidities, and now on the top of that, there is a diagnosis or potential diagnosis of MS. Okay, so listen to what you were already told. In the meantime, maintain balanced diet that is fresh, organic, seasonal. Avoid any processed, ultra processed foods. And what are they? So they usually are very colorful, very tasty, very salty, very sugary, and things that you just put in the microwave or oven, and in 5 minutes or 10 minutes time you got your meal. These are processed foods, right? So try to avoid anything that is home cooked. You start from the scratch, or maybe you buy some recipe boxes and you sort of chop yourself and prepare that nourishing your body, rich of nutrition food. Is amazing what you could achieve in the meantime. Also, make sure that you're well hydrated. You should drink 2 to 3 liters if your kidney function is good a day of still water. Try to avoid all those sugar, energy drinks, fizzy drinks that is not nice on your stomach anyway. So make sure that you are having a still mineral water, spring water, anything like that is gonna make your function. Body function a bit better, because our body consists of 60% of the water inside us. So all these cells are lacking of the fluid and water to maintain or improve the function. So that's super important. Engage in regular exercise activity, whether it's in a format of the walking, jogging, going to gym, swimming, playing golf, playing tennis, dancing. Anything is suitable for your condition, and you like it and you're going to maintain it. For sustainability, it brings you a lot of joy. Just stick with that. And if you haven't done this before, try to go for a walk, long walk, or maybe short walk to start with if you haven't got that physical fitness, which you can build up. And it has got a lot of preventative and neuroplasticity effect. That means that it forms new network in the brain, and the function that you lost, it you may regain over the time. It's evidence based. It's never too late. And to manage stress, you can try some relaxation techniques. Make sure that you have a space, a room, a place, a corner in your room where you find that sort of present moment. Maybe a light music, maybe you can light the candle, use some aromatherapy, and listen to the meditation tracks. It could come in a format of the Be Well with MS podcast, or Headspace or Calm app provides you similar um, approach to being that present in that moment without dwelling too much on the past and the future, and finding that sort of resilience and better coping strategies. That's an amazing technique to learn, to be honest. It doesn't feel okay when you start, but you build up that stamina over the time. And also, if you are already prescribed some medicine for your symptoms, continue that. Don't stop, because you will worsen the situation. If the GP doctor already decided to manage your pains and aches, that's how you should pursue. And if the mental health is an issue, seek some counseling. There are some self-referral services. We've got one like TalkWorks, for example, in Devon, that you can self-refer, and there is the different other services that you can get access from psychologists and get some counseling. Again, you can access that via GP doctor. Therapy, psychotherapy is super important, in particular if you suffer with depression, anxiety, and PTSD type symptoms and mental health illness. So, and stay positive, stay hopeful. Advancements in MS research continue. To offer new treatment options are possible. We have on the radar, under the radar, so many different approaches in this life, and everything obviously takes some time, but it's coming, and we will be able to offer you more and more solutions, and and try to improve and help and maintain your function with the therapies that we have available, and new therapies on the horizon to come.
Yeah, it's really good listening to you there. But when I do listen to you about healthy lifestyles, I think, oh yeah, I should be doing that. Oh yeah, I need to stop doing so. Yeah, I was thinking, yeah, I need to build in some of those things into my routine in terms of um, diet and exercise. But yeah, it's really good to sort of see the holistic approach that you take towards health, and how to, live as well as you can in your situation. So
Yeah.
for someone, maybe they've sort of dropped off in terms of seeing their neurologist. So maybe they haven't been for a few years, could be for lots of different reasons, mental health, changes in location, that kind of thing. Should they try to get an appointment again with someone, would you say?
Of course, I think it's important to get that support from the healthcare providers. I know that there are some people in progressive stage of MS that they've been discharged many years ago, and they just plot around. That they don't get any input from the healthcare providers. So I think it's super important to educate yourself about the available treatments. These days we have siponimod, for example, for secondary progressive MS. We have so many different options for relapsing remitting multiple sclerosis, and we have also focus on symptom optimization. So it's super important to get engaged with a healthcare provider, because you will really benefit from it. I know it's waiting time, it's hard to get in, but once you're into the system, you get a lot of support and help.
Amazing, yeah. And I was curious, earlier on, you kind of mentioned MRI scans, particularly when people are going through that newly diagnosed experience. Recently, we had a clip on our social media, and it was of a person who lives with MS, and they were sort of talking about their annual MRI scans that they have. Is that something that everybody who lives with MS, should everybody be having an annual MRI scan?
When we talk about the diagnostics, each diagnostic tool has to have a reason why we are doing things for people. We have to rationalize each request. So there are some cases in MS that whether they have an MRI scan or they don't, it wouldn't change our management. And I address this probably end organ, very advanced MS diseases that uh, in the current environment and the policies that we've got in place, we are monitored, and we follow the NHS England recommendation and algorithms these days. We are probably not being be able to prescribe high potency or any disease modifying therapy who are bedridden at the moment within the current NHS situation, and the funding schemes that we have as a prescribers. So the rest of people who are fully mobile, who live with progressive or relapsing MS, and I'm not going to subtype that, I'm just talking broadly, progressing or relapsing, because progressive MS can still have relapses, and the relapsing form can still have progression. At the end of the day, we are dealing with one disease. But these people who are still up and about, they do live life. Maybe they still work. Maybe they still function at the high level or lower level. It doesn't matter. All people have a potential to be better and have a protection and preventative therapy in place. So this is my maybe own view, but I do scan most of my people that come to my clinics. because I see the potential in every single person, and I want to give that life, if possible, or at least maintain the life that they have at this time moment.
We've mentioned earlier, Agne, about disease-modifying treatments. Do you know, sort of, for you in your practice, is there a perfect time, a good time to start that conversation about DMTs?
I'll share my own experience. When people are newly diagnosed, it's overwhelming experience and a lot of information to take in. So we broadly speak about what is MS and what to expect within 6 months and what investigations are to follow and stuff. But we do bring people a few weeks later to have a decent, detailed discussion about the disease modifying therapy. And we do that relatively in a short period of time after the diagnosis. We talk about weeks because they need to understand the evidence of the disease activity, the evidence of the potential treatments around to reduce that activity. And it's important to have this open, honest conversation with neurologists about the benefits, risks, and timing of the DMTs. Also, adherence, monitoring, and this decision is usually done in a manner of the personalized way, because it needs to match your lifestyle, your beliefs, whether this medicine is going to work or not, your adherence, how often you're going to administrate this drug, and potential side effects. It's an individual choice, individual condition, requires an individual approach and attention.
Amazing, thank you so much. And we're nearly out of time with you today, Agne. But just finally, is there anything that you'd like to say to everyone who lives with MS? Anything that you would advise them to try and do?
So I would suggest that you have to advocate for yourself in your healthcare journey. You have to become a champion patient who is equipped with the knowledge, information, latest MS research, what the treatments are around. Maintain a strong support from your friends, family, forums online, people who are already living with MS and are on medicine or maybe not on medicine, and how they navigate through. And prioritize your self-care, including physical, mental well-being, and consider participation in the clinical trials to contribute MS research, because without that we wouldn't know how to best approach and how to develop treatments that are really groundbreaking and improving people's lives. And also reach out to MS organizations for resources and support, such as MS Trust, maybe MS Society, depends on your locality and how you get best response from these organizations and the team that works tirelessly and enormously to support the community with MS. And remember that MS affects each person differently. So individualized, personalized care and lifestyle choices are crucial.
Amazing, thank you. So I'd just like to say a huge thank you to you, because there's so much information and so much, great advice throughout this chat. So I've learned a lot as well. So thank you so much. I was just going to say, is there sort of anywhere, if people want to hear more from you, from your podcast, from your online content, where's best to find you, Agne?
First of all, thank you so much for having me. It was a great pleasure, as always, Nick, talking to you about the best approach living with a chronic conditions such as multiple sclerosis. And you can find me on the media platforms, but more condensed and structured way of getting my podcasts available, and listen to the various different episodes that I cover various different topics with different experts in this area in MS field. It's www.bewellwithms.com. Thank you very much.
Amazing, and we'll make sure we link to that in the show notes as well. So thank you so much.
If this was a commercial podcast, here is where there would be an advert. But as we're charity, and you know this by now, we don't do that. So instead, we'd like to take this opportunity to tell you all about our fantastic resources for people with MS.
Yeah, and really good place to start if you're not too sure where to look is our website. So that's mstrust.org.uk. And on there, you'll find lots of different resources from all aspects of life with MS. Of course, we've got lots of information about the topic of this podcast, which is how to make the most out of your appointments. So if you head to our search bar and you type in appointments, you'll be able to see lots of different articles, blogs on how to prepare yourself for that appointment. So again, so you've got that nice structured approach when you get in there, and you have something to fall back on. If you start to feel really overwhelmed, you've got that structure to go back to. So whether or not you're talking to someone in person or online, you'll know a little bit about what to expect when you go to those appointments. We'll also link to these notes in the show notes below as well.
Yeah, back. All this information from Agne. I mean, Agne is always fantastic. She's so good at talking through all these different scenarios and ideas. I love especially the ideas on how to keep well while you're still waiting for the appointment, and also how to prepare for it. I got an upcoming appointment actually for the first time. I'm going to see my neuro since long before the pandemic, because everything else has been virtual, or it was sort of just over the phone. I don't know about you, but I'm like really bad to prepare for meetings that are on the phone. I don't know, because you always feel a bit stressed, and quite often when you have phone consultations, they tend to be sort of, oh, we'll call between this time and that time, so you can't just sit down and sort of wait for the appointment. So I think once I took my yearly neurologist appointment when I was out in the middle of Tesco or somewhere, and it's not ideal. So I'm quite actually looking forward to going in prepared for a meeting this next month. So I'm trying to sort of really take opportunity to write down any questions that I have. So I do have a proper list to bring along. But I have in the past kind of also brought along my husband to appointments, which were one of those things that Agne was talking about. A bit like moral support, but also to remind me of anything that I might have forgotten. But also, I guess it's important for partners because they might have questions as well. Have you gone along to many of your partners' appointments, Nick?
I have actually, Helena, and yes, it was interesting. The first time that I kind of went with my partner, I wasn't quite sure what I was best to do. So I was thinking, I don't know about MS, and actually, but it was just important to be there for her. But then also kind of after going to a few, we find it quite helps to, hearing some of that information can feel really overwhelming for, particularly for the person who's there living with MS. It's going to be a lot of, emotions and stress potentially, and the unknown, the unpredictability, and also just terms sometimes that we're not familiar with, and without being health professionals. So actually it quite helps in our relationship if I can go along, and then we can just kind of chat afterwards, because if you're hearing some of that information and actually you might struggle to take it all in if you're in a heightened emotional place at that time, and actually just having that person who can talk about, oh, actually they said this thing, and actually they use this term, and like, let's go and look up this strategy that they suggested, to actually kind of what's the word that I'm looking for, like debrief.
Yeah.
So yeah, it can actually be quite helpful to just to have that information debrief at the end of the session too, and go over what the next step should be together.
And I think actually that is a really important question that we quite often, I think when the information people that work at the MS Trust get asked, how should I prepare? They always like to include that question, like, what's the next step? So, should I be starting on a new treatment? What do you want me? Am I being referred somewhere else? What's going on? What should I concentrate on next? What should I do? And I think, yes, if you bring someone along to your appointment, and of course that doesn't need to be a partner, that could be a friend or a parent or even a child, it's but actually sit down afterwards and have some sort of action plan. It is a great way of doing it. I think quite often we hear about people who wish they would have asked a question that they might not have dared to ask, or they've been a bit embarrassed about. I know Claire from our information team, when we did a podcast a while ago, she was saying that question that people ask when they're just opening the door and they're leaving their appointment, and just that last question. And sometimes that could be like the most important question of the whole session. So I think to really just sit down, make the questions, and then don't be embarrassed. Just, everything down there. And then when you're at the appointment, other things might pop up and you might think of other things, but just don't forget about the questions that you have already on that paper, because as we know, those appointments are quite short. So therefore, it's really important to actually get those kind of questions that you really prioritize trying to get an answer from, then and there in the appointment. So it's a lot to think about. And I think it is really useful if you do have a person with you to sort of help you out with that and take notes. Or, you could ask if it's okay to record. For instance, you could just put down your phone perhaps and do a voice recording, but just double check with the neurologist if they're okay with it, just in case you struggle to take notes or remembering things. Because I know that I quite often can come out of a meeting and go, oh, what was that? What happened in there?
Yeah, absolutely. Yeah, someone else to just sit there and just write some stuff down. I think that actually there's so much value in that as well. And, it doesn't have to be your partner, your spouse. Anyone can come with you to sort of take on that support role as well. So yeah, it's definitely really important. And as Agne was saying, in terms of the sort of questions that might be a little bit more sensitive, they are health professionals who deal with this stuff all day long. You don't have to feel embarrassed in that situation. They will have heard your question probably hundreds of times, right? And they're not judging you. They're there to support you, and that's what they're there for.
Yeah, they will have, like you say, they will have heard it, or they will have heard something that's even in your ear. It might be even stranger or weirder or more, horrible, what have you. They'll have heard it before. This is what they do for a living. So yeah, I just ask. If you don't ask, you won't find. We hope that you found this episode useful, but we do want to remind you that if you do have any questions about MS, and or if you're struggling to see your MS health professional, the MS Trust is here for you as well, and we're happy to try and find answers to any questions you have. Now, we're not medically trained professionals, that's important to point out, but we will try to, the people that are working in our inquiry line, they are very, very good at trying to find out any answers or pointing you to the right people who would know these things. So do get in touch with us if you do have any questions while you're waiting for an appointment.
Yeah, and you can access our helpline team. So that's between Monday to Friday, apart from UK bank holidays. And the times that you can reach them is between 9 a.m. to 5 p.m. Outside of these hours, you can also leave us a message and we'll get back to you as soon as we can. So you can go ahead and call that number on 0800 032 3839. If you'd rather not talk to someone over the phone, I know sometimes it's more appropriate to get in contact via email. So you can reach the helpline team via ask@mstrust.org.uk, or you can also contact us on social media as well.
And on social media, you can find us on Facebook, YouTube, X, Instagram, TikTok, and Threads. And you can find this podcast on Spotify, Google and Apple Podcast, and Amazon Music, and other places where you would normally listen to your podcast. We would love it if you gave us a review. We've seen some reviews already and they've been very nice. So it would be lovely to hear what you think of the podcast. Have you got questions that you would think we should be asking health professionals, or topics that you would like to see covered? Or maybe just let us know how you're getting on with seeing your MS team. Let us know. And I guess now I will go and prepare for my appointment with my neurologist and write down all these things that Agne's been talking about. And we'll see you in the next episode. Bye.
Bye then.